Man, I keep having to go to the bathroom.
Well, maybe it's because you keep drinking so much water. I mean, you just finished all those water bottles off in the past 10 minutes.
Well, maybe, but my mouth is super dry, and no matter how much I drink, and I've I haven't eaten a lot of salt lately either.
Huh.
It's weird.
Has this been happening for a long time, or have you just noticed it today or in the past couple days?
No, it's been a few days, maybe a couple weeks. I haven't really noticed. Felt tired more than usual, and sometimes I get nauseous after I eat. Maybe I'm coming down with something. Who knows?
Yeah, who knows? Well, actually, my 15-year-old cousin had some of the same problems you're having, and she was actually diagnosed with diabetes almost a year ago now. Now, I'm not saying that's what you have,
Yeah.
but who knows?
Wow, that's
I'd
kinda
get it checked out if I were you.
Yeah, that's kind of crazy. My uncle and grandpa on my dad's side, had diabetes, and now that I think of it, my mom's brother did too.
Wow. Wow. I mean, you can call and make an appointment at the doctor's office and let them know your symptoms, and I'm sure they'd, figure it out.
Yeah, I think I'm going to.
Hi, Kyle.
Hi.
How are you doing?
Good. How are you?
Not too bad. So you haven't been feeling right lately?
No.
Alright, let's take a look at your file here. The nurse told me that you've been urinating frequently and vomiting after meals sometimes, and you're always thirsty.
Yeah, that seems about right.
Okay. Have you been dieting at all, or change of food habits, anything like that?
No, why?
Well, I'm just wondering because you look a lot thinner from the last time we've seen you. When your weight says you lost 10 pounds, that's kind of abnormal.
Yeah, I guess I just haven't been eating as much. I'm not really hungry. And when I do eat, I usually don't feel good afterwards.
Okay. It's kind of strange. We're going to take the rest of your vitals here now. We'll listen to your heart rate, check your blood sugar and everything like that. The nurse did take your blood earlier, and I'm most concerned to check that because I want to see what your blood sugar levels look like. It also shows here that you listed under family history that you have 2 uncles and grandpa that all had diabetes. Is that right?
Yes, that's correct.
Okay. Well, we're going to run a series of a couple more tests here. I'm concerned that you may have type 1 diabetes based on your symptoms and the information that you provided. Your blood glucose that the nurse checked for you when you first arrived was at 260 milligrams per deciliter. Normal would be around 70 to 100, so you're a little high. And we're also going to run a few more blood tests to confirm that diagnosis just to make sure we didn't have any misreadings. We'll get an A1C test, which measures the average blood glucose over about 90 days. And the fasting blood glucose test, this one checks your blood sugar when you haven't eaten for the last 8 hours, which I think we had that done for you already. And then one more test that looks for autoantibodies in your blood. We're also going to take a urine sample for ketones to make sure that you're not experiencing ketoacidosis, which is a serious complication that can happen when your body starts using and burning fat for energy because your cells aren't getting the sugar, enough sugar to use for energy, basically. And this leads to a buildup of acid in your bloodstream, and it can be fatal if we don't treat it correctly. So, otherwise, let's get you down to the lab and have the rest of the tests done for you. And when you come back, we can talk more about your diagnosis if we have any, and we'll get you your situation figured out.
Hey, thank you.
Hey, how are you doing?
Good, how are you?
Good, welcome back. How'd the test go the other day?
It went really smoothly.
Yeah, not too painful?
No, not at all.
Good. Well, we have some news for you, but I'm just going to tell you not to worry. Everything's going to be totally fine. People deal with this every single day of their lives. It's totally manageable. But we do have our tests confirm that you have type 1 diabetes.
Okay.
So, first off, let's give you a little information. Diabetes is an autoimmune disease. This means that the immune system attacks and destroys the insulin-producing cells in your body, which are called beta cells. Stuff you don't need to know, really. Which come from the pancreas. So there's a lack of insulin because the pancreatic islet cells stop producing enough insulin inside your body to maintain the normal blood glucose level, which we tested your blood sugar for. The reason for this and why this is caused in many individuals is completely unknown or to exactly why it happens. But since you do have family history and your 2 uncles and your grandpa, you do have a higher chance to develop it. So kind of explains that. The treatments for this include being treated with doses of insulin on a daily basis. This is done by inserting an insulin shot in the needle form under the skin or at least into a fattier area on your body. And this way that the insulin can get absorbed faster into your bloodstream and then this can access the cells inside your body that need the insulin. Another popular option is the insulin pump, which is sometimes considered a lot more easier and less of a hassle. The pump is a small device that continuously delivers insulin to your body over a 24-hour span. It keeps your blood glucose levels normal, and it pumps it into you between meals overnight, so you don't have to really worry about giving yourself a shot or forgetting it. These treatment options and some lifestyle changes will be better discussed when you meet with your diabetic educator later on. She'll know a lot more details and show you how to stay on track with your blood sugar and keeping up with your insulin and your meal plan and everything like that. Finally, some last information for you. The prognosis for diabetes varies patient to patient. It can be based on many different items of the individual. It's possible to control with proper medical attention, which we're going to be giving to you obviously. Long-term complications sometimes do arise with diabetes and are important to take note of. High blood sugars can do a lot of damage to your body, which you'll learn more about, especially in the smaller vessels and nerves. The uncontrolled diabetes can lead to blindness, causing damage to the capillaries in the back of your eye and your retina, and that can lead to fluid loss and blood leakage in there, which obviously doesn't sound good. It can also cause kidney failure because the kidneys have to filter more blood when your blood sugar levels are high, and this damages your kidney filtering system. Other risks are heart disease, amputations, because damage done by excessive blood sugar to the nerves and blood vessels resulting in loss of blood flow and feeling. So, a lot of times you hear about diabetics will have amputations of their feet because they don't know of a sore on their foot and it gets infected and leads to a bunch of other things. So, just some things to keep an eye out for, and you're young, so I'm sure you'll be able to take care of it. But lastly, I know this is a lot of scary information, but we do need to tell you all this just, to keep you aware. But we do have some good news. Your urine test did come back negative for ketones, so you're not experiencing any ketoacidosis, which is a great sign right away. We got it in time. We're going to have you meet now with a diabetic educator. She's a very nice lady. She'll tell you everything you need to know and how to manage your disease going forward with your life and how you can feel better almost immediately as long as you stay on track with your plan, and you should be good to go. So I'll bring you down to her.
Okay, thank you.
Go.
Hi Kyle, I'm here to go over some treatment options with you, as well as give you some basic education on nutrition and how diabetes will affect your life. Any questions yet?
The doctor said something about needles. Do I have to give myself shots?
Unfortunately, that's the only way to give yourself the insulin that you need, is through an injection of some sort. But before we get into that, let's get into the basics. Did the doctor explain to you exactly what diabetes is and why insulin is so important?
Yeah, diabetes is when the pancreas doesn't produce enough insulin anymore, but I'm not sure why insulin is so important.
Okay, well, insulin is a hormone that regulates your blood sugar. Think of it kind of like a zipper. So it pulls the sugar out of the blood and puts it into the cells where it's used for energy. Without insulin, your cells aren't able to get the energy that you need, and your blood is basically being overwhelmed by sugar.
So that is why I've been so tired lately?
Yep. Let's talk treatment, okay? So your body's not making any insulin, so we got to get it to you some way, right? That's where, unfortunately, the needles come into play. So to start with, we're going to introduce you to your new friends. Vials of insulin and syringes. Basically, this is the way all diabetics start with their treatment. You got to learn the basics before we can go on to more advanced things. So we'll start here. So basically, each morning you're going to give yourself, there's 2 different types of insulin here. This one is a long-acting insulin. You'll give that to yourself every morning, and that'll basically keep your blood sugars level throughout the day so we don't get any spikes or dips down too low. And then you're going to give yourself this insulin, which is a short-acting insulin, and you'll give yourself that with each meal. And when your blood sugar gets too high, try to keep it in that target range. And then another thing that we'll talk about today is how to carb count, because that's a very important part of managing your diabetes. So I'll show you how to read like nutrition labels and where you can get basic information, like if you go to a restaurant, how to find out how many carbs are in their meals and stuff like that. Let's see. I'm also going to show you how to use a glucose meter. I know the nurse used one of these on you when you first came into the office here. This just, you use this little lancing device to poke your finger and the test strips, and that'll give you what your blood sugar is at, so you'll need to know that before you give yourself your insulin every day. And that just takes a small drop of blood, relatively painless, okay? Any questions so far?
The doctor mentioned an insulin pump. I don't really like needles. So.
Sure. An insulin pump, like I said, is a great device once you get the basics, so we'll have you start there. But once you're able to control it this way, we can teach you how to use an insulin pump. I actually have one here that I can show you real quick. So, while it doesn't completely eliminate the need to poke yourself, you still have to do it every 3 to 4 days. Dramatically reduces the number of times, because with this way you'll be, injecting yourself probably, at least 5 times a day. This way you'll be doing it once every 3 days or so. So this is a pump. Step over, and this is what holds your insulin, and then you have a tube here. They do make tubeless options, but this is the one I have. And that's how your body gets the insulin, and you have to use all these different supplies here to inject it, so it looks kind of scary to start with, but it's really not so bad. Makes your life a whole lot easier. So basically the way a pump works is that it delivers a little tiny dose of that short-acting insulin all day long to keep your blood sugars level, and then you input how many carbs you're eating, and it calculates how much insulin you need. Does all the work for you. Just a couple presses of a button. This pump is also cool because it has a sensor that looks like this, and that you can use to monitor. It monitors your blood sugar continuously for you. It's called a continuous glucose monitor. So you wear that with your pump, and then you put your blood sugar in, and then it just keeps reading it, and it alerts you if your blood sugar gets too high or too low. So that's an awesome way to keep your levels in balance, because that's the most important part of having diabetes, is to keep your blood sugar as normal as possible. So you can see there's a lot of stuff that goes along with a pump. That's why we like to start people off with a little bit easier way to get started with. I also have some information here for you. It's about a new trial that they're doing this summer about, it's called a closed loop pump. It monitors your blood sugar with a sensor and then adjusts all the insulin for you automatically. So that's a huge, looks like it's going to do really great things for people who have diabetes and make it a lot easier to control. Any questions on that?
No.
Okay.
Thank you.
Let's get started here and show you how to drop a syringe. Gotta hold on to that.
So, have you ever been to this place before? Do you know if they have?
No, but I heard they have good burgers.
Yeah?
Yeah.
Sounds good. So how's everything going? Did you ever find out anything when you went to the doctor the other day?
Yeah, I do have type 1 diabetes.
Wow, are you going to be okay?
Yeah, it's not something that'll ever go away, but it's something that's controllable with medicine and just a few changes in my life.
Well, like what kind of changes?
It mostly has to do with like me testing my blood sugar with this meter right here.
Okay.
And then calculating everything that I have to eat and drink, staying away from foods and that have a lot of sugar, and making sure I like eat healthier. And I have to give myself like insulin shots several times a day.
Man, that seems like a lot of work.
Yeah, it kind of. I'm starting to get used to it though. It's a good thing that I went to the doctor when I did though. They caught it early enough and I didn't have any damage from the disease yet. So as long as I stay on top of things and manage my blood sugar, I should be just fine.
That's good to hear.
Yeah.
Let's have a burger.
Yeah.